Talking about the somatoform disorders, it's basically the psychiatric conditions that are resulting in the physical symptoms as well. So this is quite a simplified definition of the somatoform disorders that a lot of people are suffering from. So sometimes the psychiatric conditions can affect the physical conditions of the body, and these can affect the functionality of the person in return as well. The person can go into stupor, the person can have amnesias, and all of these physical conditions would be a result of the psychiatric condition of that person, or the psychiatric condition that the person is suffering from. It can be any post-traumatic stress disorder, it can be any conversion, or which is also known as the dissociative disorder. So these conversions and the dissociative disorders collectively can have the physical symptoms. So all of these somatoform disorders, there are a lot of variants that we see clinically, that clinically usually manifest themselves in quite an interesting pattern. So that is what we're going to discuss in this final section over here. The manifestations are quite variable in the individuals, and then we'll move on to the management. So the management guidelines, as in any psychiatric ailment, it basically includes the counseling, the social support, collectively. Sometimes it needs the pharmacotherapies. The anxiety disorders in such individuals have to be treated. The panics have to be treated. So depending upon the severity of the symptoms in the person that we are dealing with, so it's basically the individual case that we're going to treat in such cases. We cannot really define the treatment collectively. It depends upon the clinician, what he feels right at that spot for that particular individual, and then he's going to basically make out that management plan for that particular person. Now, the risk factors are again going to be very important in these individuals. The prognosis is going to be seen in these individuals, and it has its own significance. So the somatization refers to the physical symptoms suggesting physical disorder for which there are no demonstrable organic findings. So that is basically the highlight for these somatoform disorders that we are discussing over here. The symptoms are linked to the psychological factors or the conflicts that the person is suffering from. It can be any traumatic condition that the person had in the past, and he's having conflicts about that event or about that occurring that took place in his life, and that is going to affect his present day situation as well. Such disorders at extreme end of somatization spectrum, they are quite oftenly seen. The differential diagnosis for these and the conversion disorders, it can be basically confused with a simple malingering phenomena. So there are a lot of variants present, also known as the Munchausen syndrome, in which the person is sometimes confused with a malingerer. So we have to basically distinguish either the person is faking that condition or is he suffering from that condition in reality. Sometimes it's quite tricky to distinguish between these two. So labeling a person as a malingerer is not usually quite effective. And when you have doubt, give that benefit of doubt to that patient. Somatization disorders, there are multiple and recurrent in their characteristic. Frequently changing physical symptoms are usually seen in these somatization disorders, and then the course of disorder is usually chronic. So the person will have that borderline personality right from the start, and even when he was not suffering from these somatic conditions, still he had that borderline personality for that physical ailments due to his psychiatric conditions. So that is what we're going to highlight over here in this particular individual. The disruption of the social, interpersonal, and the family behavior. So a complete history taking, when you get that history of that relationship, and as well as the family history, the past history, the substance misuse history, that is again going to highlight whether the person was suffering from this social, interpersonal difficulties in the past or not. So such people would be more prone to these somatoform disorders in the everyday life. Now, there is another disorder which is known as the hypochondriacal disorder. The main feature over here is the persistent preoccupation. The possibility of one or more progressive physical disorders is usually seen in these individuals. There's a persistent somatic complaint. The person would usually give you a history of constant headache or constant stomach aches, and all of these physical symptoms are going to be related to his psychiatric conditions. The normal or commonplace sensations are usually found in such individuals. They are interpreted as abnormal or distressing. Marked depression or anxiety is also noted down, and that may justify the additional diagnosis as well. The somatoform autonomic dysfunction is another variant. The physical disorders of systems is usually found in such individuals. The order of autonomic innervation is usually found. The cardiovascular system is usually maintained in such individuals. The gastrointestinal system is affected along with the respiratory system and the urogenital system. So all of these systems are affected in these individuals. Then the symptoms are of two types basically. The complaints are based upon the objective signs, the palpitations, sweating, flushing, tremors, and the expression of fear and distress. So this is the group of symptoms that is usually going to be present. The subjective complaints are the fleeting aches or pains, the sensations of burning and the heaviness or tightness, retrosternal constrictions, and the feelings of being bloated or distended. So these are some of the subjective complaints of the patients as well. The persistent somatoform pain disorder is another variant that is usually defined as the persistent severe distressing pain which cannot be explained fully by a physiological process or a physical disorder. The associations are with the emotional conflict, and the psychosocial problems are usually seen in such individuals. There is a marked increase in the support and in the attention as well. So sometimes it is an attention gaining disorder that is seen in these individuals. A common social support system that is usually present in such individuals. It can be the friends, it can be the family of these individuals that can provide support to these individuals. The risk factors are the childhood experiences, the somatized mothers, so the family history is important to take, and the depressions may be present in these individuals. The prevalence is usually, they are more common in the infants. The assessment should be based on the factor that the clinician should exclude any physical problem. There should be a link between the physical symptoms and the psychological stress, and the psychological treatment is given to such individuals. The early interventions are more likely to be successful. So in this section, basically, we dealt with the different somatoform variants, somatoform disorder variants that are basically including from the lesser severity to the moderate and to the more severe cases, and how do we deal with these cases and how do we manage these patients. So that is the end of this section. Thank you for watching sqadia.com.